Well, good morning or good afternoon, depending on what time of day you're actually watching this. My name is Dr. Julia Lewis, and I'm a consultant addiction psychiatrist. And I've worked with NHS addiction services for more years than I care to mention. And I've been asked today to talk about the effects of alcohol combined with prescribed medication. Now, this is a particular issue for those of us that are over 50. Why is that an issue? Well, the sad fact is that as we get older, we get prescribed more medication. And let's not forget the medication, they're chemicals. And when they go into your body, a chemical reaction occurs. And various different things can affect that chemical reaction, and alcohol is one of them. The other issue is that as we get older, the ability of our liver to clear chemicals from our system reduces. The liver gets tired in the same way that we get tired. Now, alcohol is also removed from the system by the liver. So if the liver is trying to remove the drugs and it's also trying to remove the alcohol, sometimes there's an interaction at that level as well. So we're going to talk a little bit more about that. But first of all, this is the bit of advice I'm going to give you. Whenever you're talking to a doctor or any other type of prescriber and they're talking about prescribing you some medication, be very truthful about how much you drink. It's important. Don't feel any shame in it, but it's important that they know how much you drink, because that can influence how safe medication's actually going to be. So let's consider some of the ways in which alcohol can affect your medication. The first one I've mentioned is about this thing called metabolism. Okay, so chemicals, when you put them in your system, they do something to your system, and some of that we want. That's why we take medication. But ultimately, that medication's got to be removed from the system. And there are two ways that happens. It happens because the liver detoxes it, turns it from something that's active to something that's inactive that can be removed, or it just gets passed out through the kidneys. Now, alcohol will affect the liver. Alcohol is detoxed in the liver, and the liver has actually got a finite capacity for detoxing. So you can overload the system. And as we get older, that capacity reduces. So if your liver is concentrating on removing the alcohol, it's got less reserve to remove other drugs that it detoxes. Things like anticoagulants. So these drugs that you take when you've had like a clot in your leg, a DVT, that's going to stop you having another one, hopefully. Alcohol affects the ability of the liver, slows it down, the ability of the liver to remove that drug. So actually the dose of that drug that you need will need to be altered if you're drinking more than you should be. So it's very important, as they say, if a doctor's prescribing that kind of medication, you be truthful about your drink. And there are other medications that's got the same effect. So always check that nice little insert that comes in the box with your medication, and always talk to the person prescribing about it. So that's the first way, alcohol affecting liver metabolism. Second way is some drugs have side effects. Well, all drugs have side effects, but some of those side effects are worsened by alcohol. Now, alcohol is a sedative. Okay, for a lot of people, when you drink alcohol, you get quite sleepy, you get slowed down, your speech slurs. That's because alcohol is a sedative. If you are taking medication that's also sedatives, now some of those, they're designed to be sedatives. So things like diazepam and temazepam, stuff like that. Others are not designed to be sedatives, but their side effect is sedation. So things like what we call the opiate painkillers, tramadol, codeine, oxycodone, all of those. Drugs that cause sedation, you add alcohol in as well, more sedation. Okay, now sedation can be troublesome. Okay, you don't want to be oversleepy during the day. Makes you more at risk of falling over, makes you more at risk of making mistakes in things that you're doing, but also too much sedation turns into coma, and from coma comes stopping breathing, which is never a good thing, okay? So be very wary about mixing alcohol with drugs that cause sedation. So that's the other thing, alcohol affecting side effects. And then finally, there's the fact that alcohol can make worse the condition you're taking the medication for in the first place. So we know alcohol increases your blood pressure. So if you're on blood pressure medication and you're drinking, you kind of got two things battling one another, which kind of doesn't make sense. The other one is antidepressants. Alcohol causes depression. Okay, so if you're going to your doctor saying you're depressed, your doctor's giving you antidepressant, if you're drinking to excess, that ain't going to work because those two things are battling one another. Okay, so that's another thing. Alcohol making the original condition worse. So it affects the removal of medication by the liver. It affects the side effects that some medication has, making it a lot worse. And it can affect the original condition that you were taking the medication for in the first place. So always have an honest and open conversation with the person that wants to prescribe for you in the first place, because then you can kind of get around these things. Now, it might be that as a result of that conversation, they alter the medication, or it might be that you actually, and this would be a good one, decide that you want to tackle your excessive drinking. Okay, how can you do that? Get in touch with local agencies. Your GPs will know who those local agencies are, but in the RCT region, it will be the Drink Wise Age Well team. GP should have contact details for those, but you can find details online. So pick up the help that's there, either via the prescribers themselves, or search for the local agencies and make contact.